Oh, nice to meet you, Natalie. I'm here in Kyiv with British clinicians, physiotherapists, delivering hands-on training for clinicians here in Ukraine to help with rehabilitation for those that have been in the war and civilians. 4 years on from the Russian invasion, hospitals here are still treating complex trauma injuries every day. When I visited last year, staff told me clearly they didn't need sympathy, they needed skills, partnership and practical support. As a physiotherapist myself, I know how vital rehabilitation is, helping people regain movement, independence and confidence after devastating injuries. That's why I've brought UK experts together to share specialist techniques that they can make a real difference.
Rehabilitation is really our key priority because we have huge demand in Ukraine to rehabilitation service. Of course, it's because of war and also, but not only war, because also people have a lot of conditions which have to be rehabilitated. It's really important to improve their skill and improve their knowledge, and it's also important to take participation in such meeting, in such training with experts and very well recognized experts from Great Britain. So thank you for this efforts. Thank you also Sonia and she's team.
What's been really inspiring is how collaborative this has been. British clinicians are sharing their expertise, but we're also learning from Ukrainian colleagues whose experience and resilience in these conditions is extraordinary.
It's a very great course to improve my skills, and I have a lot of people with the problem with shoulders, with spine, with leg, knee, and these people have questions, and British specialists have answers, and I'm just come here and I improve my level. It's cool for Ukraine and helpful for our patients.
I've seen a lot of colleagues who are really ready to help us. We have seen that the model that people use in another country, in the UK, are rather optimal and could be useful for Ukraine, especially in a community-based rehab. And I've seen the level of competences of our colleagues and understand what competences we need to give our professionals in education, after education, postgraduate, CPD programs, to give them ability to work autonomically.
This is international cooperation at its best. Professionals working side by side, building skills and relationships that will last long after this visit ends. My hope that this is a partnership between Britain and Ukraine, a long-term partnership between healthcare professionals. Even in the shadow of this war, we can rebuild lives.